So now we're going to continue on our exploration of a variety of different drugs that can be classified under substance use disorder in Module 3 here. So we're going to hit a range of them. We did alcohol and tobacco in Module 2. Now we're going to go over amphetamines, cocaine, opiates, and sedatives. And so what we see here is first amphetamines. Amphetamines are synthetic, whereas cocaine is more natural, what we call psychomotor stimulants. And as you can see, they simulate the actions of a variety of neurotransmitters in the brain, epinephrine, norepinephrine, dopamine, and serotonin. So you're hitting an awful lot of them with the psychomotor stimulants. And there's some pictures of common forms, one on the left of cocaine, and then usually the amphetamines come in pill form. So some of the short-term effects that we see in regards to the amphetamines and cocaine, you see an increase in heart rate and blood pressure, a suppression of appetite, and a decreased need for sleep. Sometimes it can lead to dizziness and confusion or panic states. If you think about this is an accelerator of the body, so you're revving it up. So panic states, if you have a little bit of anxiety, it's going to become a lot of anxiety. Generally, though, it induces a positive mood state where people are going to feel more confident, and friendly, and energetic. These are, of course, your initial maybe usages and at lower dosage. However, several hours later, you might see a mild kind of depressed or irritable mood develop. You also see that tolerance is going to develop quite quickly in regards to this. So we need to be careful when using those because amphetamines in particular, but also cocaine, can be rapidly addictive because you just don't get the same impact for very long before it wears off, and then you want to do some more. Long term, what we see is that it can lead to the onset of psychosis. By psychosis, we're meaning auditory and visual hallucinations, delusions of persecution or delusions of grandeur. All of those are kind of psychotic. And you can see there on the left some of the physical impacts there. Risk of strokes. Basically, you're revving up the whole engine. So if you have any weaknesses there, it's easy to literally pop a vessel and have a stroke. You may see the discharge from the nose. Of course, a lot of that also dictated by the way that you take in the drug. Might be sore or hoarse in your throat, have a variety of lung issues, and you risk heart attacks in regards to prolonged use of cocaine. Now, almost like all the other drugs that we've been talking about, you will see a disruption of occupational and social roles because, once again, it's a pretty heavy-duty type of drug, and it's going to sideline you, especially if you've developed a habit to it or a dependency on it. Now, those are one aspects. The other that we're going to talk about is opiates. Opiate or opium comes from the poppy with a white flower, and from the opium they make heroin, codeine, and morphine, which are all derived from the opium poppy. Now, you can take these opiums orally, inject it, or inhale it. So there are a variety of ways of getting it in your system. There's a picture of the singer Prince. He's somebody who died from an opiate overdose. You could have also had Michael Jackson and other famous singers among the ones who fell victim to addictions to this particular drug. Opioids are going to be synthetic versions of the opium. And a lot of times these are going to be used to reduce pain in hospitals. The ones that unfortunately we all know about are oxycodone and hydrocodone. Of course, this has become much more controversial thanks to the epidemic we have of opioid usage and the use and abuse of these pills, and especially originally starting out for pain, but we also know that they are highly addictive. And then heroin is a synthetic opiate made by modifying some morphine molecules, and that's where you go ahead and see the heroin and some of the impact there. Some of the short-term effects of opioids or opiates You can see a dreamlike euphoria. Sometimes you even have a sensitivity in your hearing and vision. And if you inject it, you oftentimes will get a rush, which is a very brief, intense feeling of pleasure. Has been described as a orgasm in the entire body with the rush. But the positive emotional effects do not last, as does the rush does not usually last for very long. And so when you continue to use it, there's going to be more negative changes in mood and emotion. And it's only going to be relieved when you intake the drug. So that's where the dependency comes in. And it becomes particularly severe with this opioid versus some of the others that we've talked about already in this chapter. If you take too much, it can lead to a comatose state, severely depressed breathing, maybe even convulsions. That's because, once again, this is a depressant, much similar to that of alcohol and even nicotine, but obviously way more intense and effective in depressing the various parts of the body system, which is why those higher doses can really lead to some negative impacts. The unpleasant symptoms are relieved usually for about 30 to 60 minutes after each new injection. So it's kind of once you get in that hamster wheel, you keep running and only pausing to inject yourself and then searching it out to more. Sometimes to counteract some of the effects of the depressing aspect of the opioids, you will mix it with cocaine, which of course is an accelerator or a stimulant, and then that can be called a speedball. So sometimes you would see that in reference. Some effects, this is effects of oxycodone, but as we just talked about, these are going to be true of most opioids. You can see the most serious effects are in red there. Possible seizures, fast or slow heart rate, a lot of difficulty with your throat, hallucinations and confusion can happen. You can break out in hives and rashes and then have difficulty breathing because of the very slow nature there. So all of those are just some of the effects. A little more specifically, some long-term consequences. Those who have used opioids for long periods of time have this kind of chronic lethargy, really having a hard time to get up and do much of anything other than, of course, search for their next fix. They're going to become preoccupied with finding and using the drug to the point where nothing else matters in their life. So there's a lot of stealing and other activities going on to feed the habit. As I mentioned before, the tolerance becomes very rapid to these, so that people find themselves having to do greater and greater dosages. And once you become addicted, of course, your lifestyle leads to a lot of difficulties. So what you can see is your finances will be drained. You'll be engaged in much riskier behavior. So just recently, when I believe it was in Indiana, you had an outbreak of AIDS or HIV, and it was from sharing of needles that people were doing to kind of feed their habit. Of course, there's some violence associated with this too, because you have other people that are in the same boat as you, and they're willing to do literally anything to be able to get their next fix. So there's going to be more violence there. And then, of course, you can also see people dying by suicide in regards to these opioids. You do have the risk for a variety of either heroin or opioids of drug overdoses, unintentional drug overdoses. As you can see here, the opioid painkillers, you have much higher rates. And this stops at 2007, and this is before you really begin to see the big issues hit places like here in Kentucky. And so this is a very mild kind of graph compared to what the reality is these days, because you're going to see those opioid painkillers just kind of go through the roof in regards to unintentional drug overdoses, which would be even higher if we didn't already have a drug like Narcan, which can offset the negative impact of the drug when people are ODing and bring them back. So a whole host of negative issues in regards to opioids. And as you can see, cocaine, you don't see quite the level of overdosing that you do with opioids. Moving on to talk about sedatives, hypnotics, and anxiolytics. You got me on that one. Don't worry, it won't come up again, other than to know that all these fall under these classes. So more specifically, what we're talking about are things like tranquilizers. Tranquilizers are often used to decrease anxiety or agitation. In general, most of these class of drugs are going to be dealing with calming people and to deal with anxiety. Hypnotics are going to allow people to sleep. And so we know there's even some over the counter hypnotics for people who have sleep disturbances. Sedatives, this is just going to be a general term for drugs that calm people or reduce excitement. So forms of sedatives could be things like barbiturates and benzodiazepines. Barbiturates, there's a lot of different ways they can be used, but they are also included in the treatment of chronic anxiety. So you could look at those as some of the medication options when we were back in our chapter on anxiety. And then benzodiazepines, these are more synthetics that have replaced in the large way the barbiturates, still used to treat anxiety disorders, usually fewer side effects involved in regards to the benzodiazepines versus the barbiturates. Short-term effects that we see here with these different classification of sedatives. A lot of times people can look intoxicated, very similar to alcohol. Should be a surprise because it is also a suppressant, just like alcohol is. And so you're going to see the same sort of characteristics: slow speech, lack of coordination, impaired judgment, difficulty maybe attending or focusing on one thing too much. You may have disinhibition of sexual and aggressive impulses. In other words, you're inhibiting your inhibition portion of your brain. And so if you have impulses, you act on them and you probably regret them later because you're not really thinking things through. And so, not surprisingly, you may also have some hostile behavior because your aggressive impulses have been unleashed that had prior been held in control by your own kind of willpower. Long term, if you're really in high dosages of sedatives, you can have a worsening of the original anxiety symptoms that it was treating. So if you are using these on a regular basis or higher dosage of them, you don't want to go cold turkey and just completely stop out of the blue. You want to go ahead and try to titrate off those by meaning just little by little. Other things that you might see in long-term users of these: irritability and paranoia, sleep disturbance, agitation, muscle tension, restlessness, and maybe even perceptual disturbances. So things like barbiturates became very popular, say in the 1960s. People thought, hey, just take these will help you relax, and everything was good until people became addicted to them. So we don't commonly see people get things like barbiturates anymore. And then the discontinuance syndrome, and that is what I was talking about. You don't really want to go cold turkey on these. You want to rather go down gradually over time. So that's going to finish up Module 3. We'll go ahead and talk about Module 4, cannabis and hallucinogens. And that should pretty much catch us up on all the various types of substance abuses that can be done. And then we'll get into things like treatment. So tune in.